Good afternoon. Thank you for coming along. So I've been joined by the COVID Response Commander, Jerome Weimar, and we just want to take the people of Victoria through where the situation for both the current outbreak of the COVID-19 position is, together with testing and vaccination updates. So currently there are 45 active cases of coronavirus in Victoria in total. Yesterday we recorded 5 new locally acquired cases, 4 at the City of Whittlesea end of the outbreak, and a further 1 linked to the Port Melbourne workplace outbreak. And I'll get the COVID Response Commander to take us through some more of that detail in a moment. The other 2 cases were overseas acquired hotel quarantine cases. 2 days ago, we set a record for our COVID-19 tests and equally for our vaccinations in Victoria, and we did it yesterday as well, and today we land a hat trick of records. There were yesterday 21,626 vaccinations in our state-run centres, and when you include the great work still being done by our GP network, that's well over 40,000 vaccinations in Victoria yesterday. And I'll take this opportunity to remind everyone that more vaccines and more GPs are coming into the network, and as they are invaluable partners in the vaccination program delivery. And yesterday there were also a further record of 56,624 COVID tests. We know, as a result of this evidence, that the people of Victoria are rightly taking this outbreak incredibly seriously and are also responding to the vaccination program as our way to get out of this COVID pandemic. So we are grateful equally to not just those people who got tested and got vaccinated, but we are even more grateful to the millions of Victorians who are doing the right thing and who are observing the 5 reasons as to why we can leave home. And in doing that, whether you're observing those reasons, whether you're getting vaccinated or you're getting tested, you are doing your bit to help our state stay safe. Our contact tracers are continuing to run hard and fast at this outbreak, and they continue to make their way through new investigations and interviews and identifying new lines of inquiry all the time. The Chief Health Officer's update last night brought into line some of those inquiry outcomes. One in particular I want to focus on was an individual who worked during their infectious period. I stress when they showed no signs of the COVID symptoms themselves, for a food distribution centre, and who visited multiple stores and grocery sites across metropolitan Melbourne on the 18th and 19th of May. As a result of those inquiries, a large number of further Tier 1 exposure sites have been added to the websites for the coronavirus update. I want to thank that company and their customers for their efforts in cooperating with our contact tracers and the department in rapidly tracking down so many of the contacts and providing outstanding assistance in making sure that we've started the testing process for all of those contacts. I can advise that the City of Whittlesea cases announced today, those parts that I referred to earlier, are actually linked to this particular case. They are direct personal close contacts, social contacts of that particular individual. The high-risk exposure sites are a number of these grocery stores in both the northern and south-eastern suburbs, and they were over a number of short visits on the 18th and 19th of May. There was a further Epping grocery store that was listed for a much longer period of a visit by this particular person, as well as a Mill Park car wash. All of these new exposure sites relate to this one particular case. So can I use this opportunity to encourage everyone to check those exposure site websites and see if they have visited any of those. As a result of this, people variously in Epping, Wollert, Dandenong, Craigieburn and a number of other related suburbs will be receiving text messages today advising them to do precisely that, to check the website, to check if you are caught by the Tier 1 exposure requirements, which, to reiterate, are to isolate, to get tested, and to continue to isolate for 14 days. There are also a number of other settings that Department of Health is managing in relation to these cases, not all of which are published online, because we have the details of everyone who attended those venues and who may well be at risk. One such venue is Mount Ridley College in Craigieburn. The Department of Education are working closely with the school and the principal, who has been in touch with the school community last night. My message to that community is that the Department of Health will contact you if there are any actions that you need to take. Unless you have symptoms, in which case, as for everyone in the state of Victoria, please get tested immediately. I want to assure that school community that we're managing this site closely and carefully and in a high level of cooperation with the school community leadership. I have strong confidence in our teams and our local public health units who are working together across all of these new exposure sites in response to this outbreak from South Australian Hotel Quarantine being seeded in Victoria for us to get on top of this. We know that there is more that we can do, and we are continuing to ramp up our efforts in response to the growing list of exposure sites. This is where you can help us, the people of Victoria. We are in day 2 of this circuit breaker lockdown, and we will get through it by us all following the rules. And thanks to everyone who is staying home, there are only those 5 reasons to leave your home. Firstly, shopping for essentials, for exercise, for medical care and caregiving, including getting a COVID-19 test, work or study if you are authorised to get vaccinated, is the 5th. If you aren't doing any of these things, it's a pretty simple message. Please stay home and keep yourself safe and keep your community safe. That's how we will get through to the other side of this circuit breaker lockdown. That's how we will keep Victoria safe, and that's how we will yet again show that we are capable of running this outbreak down and keeping Victorians safe. I might ask the COVID Response Commander, Gerard Weimar, to add a bit more detail. Thank you very much.
Thank you, Minister, and good afternoon. In the past 5 days, over 170,000 tests have been completed. We have 35 positive cases in this outbreak. We now have 3,000 primary close contacts on our system, who are all, of course, isolating. I'm pleased to confirm that of those 3,000 primary close contacts, 62% have already returned a negative test as at last night. It's really encouraging to see the number of people clearly who are coming forward for testing in the wider community, but particularly those who, of course, are coming forward from the exposure sites and in the primary close contact field. 62% of those having now returned a negative test, although they'll continue to isolate, is a very important piece of news and a very important step forward in terms of managing this outbreak. We'll, of course, see those numbers continue to move around as we continue to identify new exposure sites. If we find new positive cases, we will, of course, see both PCCs and secondary contacts continue to change. Our pathology labs are clearly working very hard, and my thanks to everybody in the wider testing system and in the pathology centres for their phenomenal work in managing this turnaround of ever new record-setting days in terms of testing numbers. And above all, my thanks to all those Victorians, those 170,000 plus people who have come forward to get tested over the last few days. It is so important that we understand your status. It's so important that we track down any potential cases that might be out there, and getting tested when you have the mildest of symptoms or when you've been to those exposure sites is the most important thing that you can do. We've now got 207 testing sites open across the states. Most of those are running with extended operating hours from 8 till 8. We've also put a lot of more staff on. We've added 19 sites over the last few days. 4 of those started yesterday, including, of course, the super 8-lane showgrounds testing site. And we have 2 more testing sites opening up today, Aquanation at Ringwood and a further drive-through site at Knox. We will continue to develop and strengthen our testing system as this outbreak continues to progress. As we discussed yesterday, my thanks to the huge team of contact tracers across our local public health units and in our central teams as continue to chase after this outbreak as it continues to evolve and change its direction, and I'll talk about that in a moment. We have a large number of exposure sites that continue to evolve on our system, and we identify those risks based on the type of venue, the type of activity that we think has taken place there, how long the case has been at those venues, their type of movement around the centre, and of course levels of ventilation and the type of activity that's going on. All of that feeds into our assessment of risk and how we prioritise our efforts around those different exposure sites. We will of course continue to review those exposure sites, and particularly as we start to see how some of these cases are looking like they're more infectious and infecting more people, and others are clearly less infectious. That, of course, also we continue to then review how that plays into our exposure sites, and from time to time we will reevaluate those risks. Sites will go from tier 1 to tier 2, or even drop out altogether. Some sites will go from tier 1 or tier 2 to tier 1. Some sites may continue to be accelerated. We will continue to do that in a real-time way, and of course these conversations are a good way for us to keep our eyes on the ones that are most important. At the start of the week, we were looking at sites such as High Point and a number of different shopping centres or shops and retail units within the High Point area. I'm really pleased to see that we're now seeing 80 to 100% of negative test results for all the primary close contacts associated with High Point. So that early focus on the High Point, a really good response by the community, those people who are in those centres, has allowed us to now really get confident around the lack of evidence of community transmission in those areas. 80 to 100% of those test results coming back negative for individual stores is a really strong result. A lot of work, of course, also in the last few days with the AFL and the MCC to follow those 2 big games, the Collingwood and Port Adelaide game and the Essendon North Melbourne game at the Marvel. Again, we've seen 70 to 75% of the primary close contacts identified at those games coming back with negative test results. So again, an encouraging step forward. We're seeing no evidence at this point of transmission at those games. We'll continue to chase down the remaining people who have not yet returned the negative test result, but again, pleased to see those negative results coming through for a significant chunk of those primary close contacts in the immediate vicinity of the positive cases at those games. Finally, of course, Stratton Finance has been a big exposure site for us. We have 13 positive employees at Stratton Finance that we've identified over the last few days. We've now tested all other people who are associated with Stratton Finance, all the other employees and staff on those premises. All of the others, apart from the 13, have now returned to negative test results. Again, my thanks to the Stratton Finance team. This is obviously a hugely challenging time for them, and we wish them well in their ongoing work to support their staff as they recover, and of course as those staff continue to isolate. But again, we're pleased that we've now managed to lock down any other potential risk at that location. Yesterday we spoke about 5 nightclubs and bars that we were particularly keen to get more information about. We talked about the 3 Monkeys in Paran, the Somewhere Bar also in Paran, the Sporting Globe in Mordialloc, the Palace Hotel in South Melbourne, and the local in Port Melbourne. I just want to say thank you to everybody who's come forward. We now have over 500 primary close contacts identified with all of those across those 5 bars. That's a significant uptick from where we've been. Around just under 20% of those have now returned a negative test result. I'm expecting to see negative test results coming in over the next few days for those 500 primary close contacts, but that puts us in a much better position. Of course, in one of those bars, the Sporting Globe at Mordy, and a real shout out to them and my thanks to them for their work in supporting us with this outbreak. We do, of course, have 1 incident of transmission between 2 people who went and had a beer there together on the Sunday. We'll continue to obviously work with that wider community to understand if there's any other transmission in that area. Our focus today, of course, continues on all those sites that I've talked about and all those other sites that we have listed on our network. We're also really now with the developments of the distribution or the wholesale food distribution driver moving around a large number of exposure sites, a large number of grocery stores around Dandenong and the northern suburbs. We're very focused on those. There's a lot of work happening in those communities to make sure that those locations are closed, that we're testing the owners and their staff and anybody else we can identify who's been in those premises, make sure they get deep cleaned, and then of course get them back open safely to continue the vital work that they do. My thanks to everybody who is involved in that sector. It is particularly challenging for small businesses to be asked to, or to be told, to cease trading, to make sure we get their staff tested and to make sure that they're cleaned and safe and ready to reopen. But it's so important that we do so. And of course, it's a big part of geography. And as the Minister has said, we're contacting people in those wider communities to make sure they understand that the virus is not just contained to a number of exposure sites. It's not just contained to the northern suburbs. This is now moving across all of Victoria with a number of different locations that we're all trying to chase out there. We've covered, I think, most of the testing operations. Again, my thanks to everybody who's come out and got tested. That continues to be our focus. We continue extended operating hours on our testing sites. And please, if you have any symptoms, no matter how minor, we'd ask you to come and get tested today. Waiting times are significantly shorter. Yesterday, we were looking at around 2 hours, reducing to 90 minutes in the afternoon. Waiting times today, again, are shorter, but it is no less important today, as it was in previous days, to get tested if you have any symptoms or any recognition with any of those exposure sites. And then finally, obviously wonderful to see so many people coming out yesterday and the previous days and today to come out and get vaccinated. 21,600, we're almost at the 450,000 number for total vaccinations in our 34 state clinics. Yesterday we did about half and half between Fisa and AstraZeneca, so great to see both of those cohorts coming out so strongly to get vaccinated. We did have a bit of a problem logging on at the Mackek and at the exhibition building this morning. So 2 of our sites, the other sites were unaffected. At 2 of our sites, we did have problems logging on this morning. Those technical faults were remedied by 10:30. We were vaccinating people throughout that time, but I do appreciate there was some disruption to some of our customers, our patients wanted to get vaccinated at Jeff's Shed and an exhibition building. So I'd apologise for the inconvenience that they suffered, but pleased that since 10:30 those centres have been raring up and running again, full bore and in a really good place. Please do, if you're intending to walk up to get your AstraZeneca vaccine at any of our sites, you're very welcome to do so. Please check on the website before you go what the length of the queues are at the moment. We will ensure that if you're in a queue, we want to make sure you get vaccinated that day. We do not want people waiting in a queue all day and then not actually make it by the end of the day. So it is important to please check the length of those queues beforehand. We will ask people, or we will tell people, if the queue is getting to a point where we don't think we can vaccinate beyond that point, to come back another day. So again, save yourself the trip if you can. Check on the website before you turn out. The call centre continues to be open and taking a large and record number of calls. And just a brief word on the way we operate that call centre. We are running now at over 20,000 vaccinations a day. This is the level that we can just about sustain, given the amount of vaccine we have available to us in Victoria at this point in time. We are expecting to sustain this level of operation for the weeks ahead. And my thanks in particular to Commonwealth colleagues for providing such support on providing as much vaccine as they have available to us in order to vaccinate Victorians. So we are keen to maintain this intensity and this level of operation of vaccination. We are, of course, keen to get as many people vaccinated, but we can only go as fast as the supply of vaccine allows us to go. So please bear with us. And if you're trying to get through to book your slot, we are booking slots every single day. The call centre will continue to be available, and we will get you through in the coming weeks. With that, the Minister and I will be happy to take any questions.
Delivery drivers,
Yeah.
is he or she linked to the index case, the Wollert case? Have we identified that link yet?
So we believe that the delivery driver is linked to case 5. So case 5 visited a number of the similar retail outlets that subsequently case 16, as we now call the delivery driver, also visited in the line of work. They visited on the same day in very closely adjacent time slots. There is at least 2 crossovers between those individuals. We're just trying to track down which exact one was the point of transmission, but we're very confident that this is part of that wider Whittlesea cluster.
How is the 5th case linked?
So
So you talked about the 4 cases were linked to the delivery driver. What's the link of the 5th case that was announced today?
Right, sorry. So in terms of the cases today, let me give maybe a bit more detail on the cases we're announcing today. So yesterday we identified the delivery driver. That was case 16. They were in yesterday's number. 4 of the cases today are either family members or close social contacts of case 16. They either live in the same household or there was a meeting of households, quite appropriately, where the transmission occurred. So 4 of those cases today. One of those 4 cases is a student at Mount Ridley College, and again, my thanks to the school community for their fantastic work late last night and during the course of the next few days as we support them to all go and get tested. We have one separate case. The 5th case today is connected to the Port Melbourne cluster. This is an individual from Stratton Finance who visited a display home in Mickleham, and one of the staff at the Mickleham display home was infected at that point.
So none of today's cases were already in isolation. Are we expecting to see more exposure?
So the 4 of those cases were in isolation. They were primary close contact of case 16. Of course, case 16 was only identified yesterday. Case 50 was also a primary close contact. We'd already identified the Mickleham display home as a potential exposure, so she was a PCC, and that's why the testing results came through.
So the 4 cases have only been in isolation for 1 day, though?
That's right, yes, that's right. So we've identified, and you'll see in the exposure site listing, a number of their movements. Some of them, Mount Ridley College is a good example, of course. That student was only identified yesterday as a primary close contact. Test results came through late last night, earlier this morning. So that's why we activated the Mount Ridley plan. And again, others in that group of 4 will also have their own exposures.
Realistically, how many more exposure sites will likely come from these 5 cases?
Look, I think as we've seen all along, exposure sites will continue to evolve, and also as we look at the relative risk of each individual. I'm expecting to see, with some of these cases being relatively new, and we'll have to see what today's developments look like, we'll see, another set of handfuls of exposure sites I would expect to come through. But I think it's important to notice, if you look at we've only been at this outbreak for 5 days now. We're starting to march through it in a very logical and a very rigorous and a prioritised fashion. So there's exposure sites that we were focused on Monday and Tuesday, and we're getting increasingly confident that we're not seeing evidence of transmission, so they're becoming less important to us. We're very focused on those clubs and bars. We're very focused now on the network of grocery stores to understand what's been happening in that kind of exposure zones. There's a couple of other sites, the school and a few others that we're prioritising.
Given the clubs and bars are of so much concern, and they were on the weekend, realistically, it doesn't look like we'll be able to open by Friday, correct? Because of the incubation period for those people who potentially and likely were infected only on Sunday.
Look, and let me channel or replay Brett's comments from yesterday as the Chief Health Officer. Look, we are taking this outbreak day by day. So when we stood here or in the other place 24 hours ago, we were focused on the clubs and social networks. We weren't looking at a whole chain of food grocery stores. That's today's focus. We're making very good progress with those. They're all closed down. We're seeing some results coming through already for some of the staff associated with those stores. We don't know what's in store for us in the next 24 hours. So, we're making, I think, exceptional progress in terms of contact tracing, and we're I think, getting close on the heels of this outbreak. But we have cases in this list of 35 cases. We do have cases that have taken a while to present for testing. That means a long exposure period out in the community. It means a number of potential branches that we've got to chase down. So the message for this is, please, whoever's out there, if you've got any reason to be concerned about your health, if you've been thinking about this, you should go and get tested, and we will continue to chase these ones down. But we're on day 2 of a 7-day lockdown. We asked for 7 days because there's a lot of work to do. There's a lot of depth to go down into, and we'll do that as hard as we can over the days ahead.
We learned today that Victoria signed an agreement with Microsoft in February for technology to be used with the vaccine rollout. What's the hold up in getting that rolled out at all of our vaccine centres?
So the CVMS system that we signed up to with Microsoft at the beginning of the year, phase 1's been in operation since the very start of our vaccination programme back in February. We use CVMS every single day to process and to process the vaccination. So when you come and get your vaccination, the system that people will be using will be the CVMS system. Phase 1 is in place. Phase 1 is working well. We're very comfortable with that. Phase 2 was always scheduled to have an online booking portal. That was intended to go live at the point that we went into a later stage of full public access. We made the decision last week to bring that work forward. That portal work is in good stage of development. It's being explored and worked on again today. We're not going to rush the introduction of that. We'll introduce that when we're ready to introduce it, and when we're confident that we've got a platform that's going to provide additional options for Victorians to get vaccinated.
So the crashes that happened today, or the problems with logging in, were
Yep.
they with the Microsoft system at the Royal Exhibition
Yeah, so
Centre?
at the exhibition building in Jeff Shed, there were some problems logging into that CVMS system this morning. The technical teams came back this morning. They understand what the nature of that fix was. There's a patch going in tonight to address that. Look, I'm frustrated about it. Let's make no mistakes. This is not what we want to see in our operational systems. But equally, when you're putting a system under this much pressure, when you're mobilising it as rapidly and as swift as we have, having a few logging on problems is not going to cause me too much undue concern.
And do we know why it was just those two centres and not, say, the ones at the showgrounds that are being run by Western Health? Are they all using the exact same system?
No. So they're all working off the same system. So obviously each of the health services has its own technical support and infrastructure that it's running off the back of. I don't know is the honest answer as to why those two sites had issues and the rest of the network worked flawlessly this morning. It could well be that we've got two temporary locations where those systems aren't quite as robust, but obviously the teams are working on that and we'll get to the bottom of that.
And you still can't put a timeline on when bookings will be opened up to online rather than people having to call this jammed hotline?
Yeah, not yet. We'll launch that online portal when we're confident that it's going to be a good option for people to use. And let's be very clear about access to vaccines at the moment. We were standing here a week ago with very low levels of demand for vaccination across our networks, and we've all had these conversations over the last 3 or 4 weeks about the importance of getting people vaccinated. So it's fantastic to see Victorians coming forward to get vaccinated in their numbers, and that's exactly where we need to be. And we need to sustain that all the way through to the end of the year to get the whole community vaccinated.
So do you think weeks or months before we'll see that online booking
weeks.
system?
Some of the border communities are complaining about being locked down. Can you just explain why we need to lock down the whole state?
Yeah, I mean, the Minister might want to comment on that as well, but before he does... I've got to listen to it. Thank you.
So we've already seen a number of exposure sites around regional and rural Victoria, Kahuna, Bendigo and others, and we've also seen wide movement of Victorians around the state before the lockdown orders were put in place. We want to make sure that no matter where you are in Victoria, but particularly in regional and rural Victoria, that you are not exposed to the virus being exported from anywhere, but particularly metropolitan Melbourne, into your community. That's a pretty simple explanation because it's based on the strongest public health advice that to protect the whole state through this short, sharp circuit breaker lockdown, we needed to just do that, protect the whole state.
With these 4 cases who were only in isolation from yesterday, do we know already how many new exposure sites they have visited and so been added to the list?
Well, Ridley Secondary College is one of particular concern to us, which we're working through, but you'll see as a result of that intelligence work being done by the contact tracing team and the public health teams, further evidence as sites come on board across the day. So we've, as Jerome indicated, seeking to prioritise the most important ones first. They're all important, but some are riskier than others, and that's why we're making the announcement around the grocery stores and the college.
A lot of talk today saying it's good news that we only have had 5 new cases today and 4 yesterday. However, epidemiologists have said, obviously with the incubation period, their fear is from kind of tomorrow to Tuesday. Do you have the same fear and that we might get a bit of a spike over the next 3 days?
Look, I take my advice from the public health team and the Chief Health Officer, and as the Chief Health Officer indicated yesterday, it is a day-by-day proposition. The work that the tracing teams, the work that the intelligence teams, the work that the local public health units are all putting in is extraordinary, and can I thank them for their outstanding work. They are working around the clock. You then add to that the thousands of people in the pathology teams. People are putting in an enormous effort to keep us ahead of this outbreak. And that's the reason that we've got the 7-day circuit breaker lockdown, to allow that work to get ahead of precisely that incubation period by slowing down the movement across the rest of the community. So the next few days will be critical, and as the Chief Health Officer has indicated, it's a day-by-day proposition.
But do you acknowledge that over the next few days, it is likely that we will see a bit more of a spike over 4 or 5 cases a day?
Again, I just take my advice from the Chief Health Officer. 4 or 5 is clearly better than 20 and 30 a day, but we can't rule out what we can't rule out until we get all of these tests done. What we need is people to follow those reasons as to the 5 reasons they're allowed to leave home, to get tested if you show the slightest symptoms, and everyone who's been identified as a close contact or in the areas of concern to respond in the way that we ask you to. That's how we'll get to identify if there are more chains of transmission out there quickly, and through our public health team, shut them down.
I saw people last lockdown was transparency and just having some direction. And yes, we understand that this is a movable feast, but can you honestly say to people that we're going to be out of this in 7 days, or should we prepare for it to be longer?
Look, it's a 7-day circuit breaker shutdown. And what we've been clear and upfront on every day is each day we review based on the intelligence and the material that we've got before us. And it's too early to make that announcement. Today is the 2nd day of 7 days. So we'll continue to work through the evidence as it comes in day by day and keep Victorians informed and accountable through opportunities like this, through social media, through any other forms that we can lay our hands on to keep Victorians up to date with the evolving situation. And more importantly, to keep Victorians engaged in what they can do to keep ourselves, our community, our state safe.
Is there any update on support for businesses that have been forced to shut down for these 7 or however many days?
Look, we all know that this is having a big impact on businesses, big and small, on schools, on cultural and sporting events, and on communities. The government's already spent over $6 billion on business support, and as both the Mr Pakula and the Acting Premier indicated yesterday, we'll have more to say upon that in the not too distant future.
I've spoken with one of those tier 1 businesses on that list that the delivery driver visited. She says that she has been left in the dark. She's been emailing and calling the health department and she's not sure what to do. Does that surprise you? Should these people have easy access to the health department and with instructions?
Well, I'm happy to follow up any particular information you have, but I know directly from having seen the outcomes of reports of conversations with a large number of the operators, in fact, all of those locations, that there's been high levels of cooperation from those businesses. There's already I know of 1 of 7 of the 9 staff have already returned negative tests, and I know that there's been really high levels of cooperation. But if you've got particular details, of course, I'd be happy to follow them up.
She's nervous about reopening her shop. She said it got deep cleaned yesterday. She's returned a negative test as well, but she can't get hold of anyone from the health department. She's emailed. She's waiting on call lists about opening her shop.
Oh, like I've indicated, if you've got specific details, I'd be more than happy to ensure that they're followed up. But what I do know is that all of the exposure sites from case 16 have been contacted, all have been cooperative, all have been closed down, and testing is well underway for all of those sites. And I thank all of those people involved in that. But of course, if there's particular details that we can work through and assist particular locations, then of course we'll do that.
We saw people turned away from vaccination hubs this morning, and also the hotline. It's the 3rd day in a row there's been issues. How worried are you that these tech stuff-ups are going to cause people to just give up on getting the vaccine?
Oh, look, my message is, of course, we apologise if out of the 2 of the more than 30 state-run testing sites that operation had those log-on problems this morning. But we've also seen, as a result of the other 30 plus operating, we've seen such huge demands at some that they've had to queue manage and to stop their queues for the rest of the day. So we know that there's a huge desire to be vaccinated out there from Victorians, and that's a great thing because vaccinations are our ticket out of this pandemic. We've got to manage that in a way that is sustainable, most overwhelmingly by the supply of vaccines. But of course, if there's more we can do, whether it's in the call centre, the vaccination centres and the IT and other systems behind that, then that's what we are in fact doing right now. More than doubling since Thursday the number of staff at the call centre. They're already pumping in unprecedented amounts of calls into that. Telstra system is struggling to keep up with that. That's, as I understand it, been the cause of the problems over the last couple of mornings, rectified pretty quickly by our friends at Telstra with the systems managing again. So my message is, please, if you can't get through, try again later in the day as we try to schedule people to get their vaccines in the safest possible way.
Are you expecting vaccination numbers to drop off today as a result of those technical problems?
I hope not. Historically speaking, weekends tend to be a little bit down, or significantly down, but what we are now facing for the first time is an outbreak with vaccines available. And over the last few days, we've seen record numbers of people coming forward to be vaccinated. So my message is, don't give up. We're doing everything we possibly can. Thousands and thousands of people are getting through the system. But also remember, our GPs actually still get the majority of the vaccines in Victoria. Work with either your trusted local primary healthcare provider, your GP, as one option if your GP is in the system. And I can just give the Commonwealth a shout out. There's more GPs coming into the system over coming days and weeks, and there'll be more provided there. But of course, we also want people to have the option of the state-run systems, which have returned 3 days in a row of record after record after record vaccination programs. And of course, I'd like to see that keep going.
Where's the acting Premier today? Is he feeling unwell?
No, I speak regularly with the acting Premier. He's working very hard on his acting Premier role, his Minister for Education role and his Minister for Mental Health role. And of course, there's a lot to do in all of those three jobs.
Has he felt any side effects of his jab?
That school should be doing again, just to clarify that message, because obviously there'll be some panic in the school community.
Well, we firstly say that there's no cause to panic. The school have really good records and the school leadership are working closely both with the Education Department and the Health Department as to monitoring the movements of just one student over a couple of days in infectious periods, and they'll be in contact through that process with the school community. So there'll be some general messages to everyone in the community, but the Health Department will be in direct contact via the school with the people who need to be contacted around what further public health measures they might need to take.
So essentially the whole school doesn't have to go into 14 days?
Well, it's not at this stage, no. We follow the lines of transmission and seek to close them down as quickly as we possibly can.
Case number 5 today, the Port Melbourne one.
Which one?
The Port Melbourne one. What was the kind of transmission event? Are they a Stratton financial worker? Were they at one of the exposure sites on Chapel Street?
Yeah, so it was a social event at the one particular social venue. So Stratton Finance person having a beer with his mate at a social venue.
Which one was it? Which venue?
Well, as I understand it, was the Sporting Globe, I think it was called, in Mordialloc.
That's the 5th one today. I thought that was one that was announced yesterday.
Yeah, you might well be right. We'll get that clarified. But just to take that as a point in terms of how the social contacts, all of these cases have been able to be directly linked back to points of the outbreak, all of which go back to either the Port Melbourne Stratton Finance or the City of Whittlesea clusters, all genomically linked to the South Australian hotel quarantine outbreak. But I might get Jerome with more up-to-date information for you on that one.
Thank you, Minister. So if I've understood the question correct, so Stratton Finance was so somebody in the Whittlesea cluster, a household member who was infectious as a result of case 1 and case 5, worked at Stratton Finance, 13 employees in total at Stratton Finance subsequently contracted coronavirus from that exposure, we think over a number of working days. In terms of the new case 5 today, or the 5th case from today, that is an employee at Stratton Finance went to an open house viewing in Mickleham, and one of the staff members involved in the open house viewing at Mickleham subsequently contracted COVID.
All the people
But they were already a primary close contact. They were identified by the Stratton Finance individual when they were confirmed positive, so therefore we were already confident that we had that one secured.
Given we've seen a huge demand in people getting vaccinations today lining up to, are they all guaranteed to get their second Pfizer shot on time?
Absolutely. So yesterday we did about 50-50 between AstraZeneca and Pfizer. Pfizer second doses are 2 to 3 weeks after the first dose. AstraZeneca, like myself and the Minister, in fact, are more like 3 months after the first dose. We are absolutely, one of the reasons when we are booking people in, and one of the reasons why the conversations at the booking call line take a little bit longer, is people are booking in their first, sometimes they're booking in their second appointment at the same time, as well as any other family members they want to book in at the same time. Can I also just correct the point? Thousands of people got through, as they should, and as they will do today, the call centre yesterday, the day before, and today going forward. People are getting through the contact centre. People are making bookings. All of the slots that we have available for vaccinations are now full, and we will continue to take more bookings as we go forward. So there is the issue we've got is a huge amount of demand. So we appreciate that it's frustrating for people that they can't get through when they want to get through. We'd ask you to be patient. We've got a long way to go on this one, and we'll keep running at the rate we're running at the moment.
What is our supply of Pfizer vaccines right now? How many do we have?
So we receive 70,000 Pfizer vaccines a week from the Commonwealth supply chain. So that is, at the rate we did yesterday, I think we did 11,000 or so Pfizer vaccinations yesterday. We are running on most of our vaccination centres 7 days a week, 8 till 8. So we're not slowing down for the weekends, even though we've seen lower demand historically at weekends. We will continue to run at this kind of rate. So we can't generate more Pfizer vaccine than the 10,000, 11,000 a day that we're doing at the moment. And we will maintain that cadence until we see, a longer term increase in supply.
You said before that the primary close contacts, about 60% of them have returned negative tests.
Yeah.
Why is that not higher? Are you having problems getting people to actually go out and get tested? And
no, not at all. I
their
mean,
self-isolation?
clearly we're seeing literally tens of thousands, 50,000 people a day coming out and getting tested. So people coming forward for testing is not the issue. Bear in mind, we are adding exposure sites continually. Every time we find a new positive case, every time more information comes to light, more exposure sites are going up. So we'll always be chasing our tail on the percentage of primary close contacts that have already booked a negative test result. I'm actually encouraged by the fact that we're seeing so many of our existing primary close contacts, 3,000 of them. Yesterday I was standing here, it was 2,200. Today it's 3,000. 62% of the 3,000 have already returned a negative test result. So I think we're making really good progress because people are doing the right thing. When they're being contacted by us, they're going out, they're isolating, they're getting tested, and we're getting those results in our system in a very rapid time.
And the number given yesterday was about 15,000 primary and secondary contacts.
That's right.
What is that number now? Do you know?
It's broadly the same. So we'll reclassify. Secondary contacts tend to come and go more quickly. As we start to get negative test results for primary close contacts, we can release the secondary contacts. I haven't checked the SEC figure this morning, but it'll be around 15,000.
Why do you think the testing numbers are so much higher now than they were during that very long lockdown we had last year when there were far more cases out in the community?
Because I think we're in a completely different paradigm than where we were 8 months ago, 9 months ago. So firstly, we have built an operational resilience around our testing systems, our pathology systems, and the whole response, the whole contact tracing response here in Victoria. But far more importantly, the Victorian community knows what it needs to do. We know, having gone through the challenges of last year and the real difficulties of last year, 2 short, sharp outbreaks we've had to deal with at the start of this year and the 5-day circuit breaker in February. We know how to do this. People, I think, know now genuinely, right, if we're going to do this, if we're going to crush this thing in 7 days, we all need to do the right thing. We need to come forward, get tested, bank those negative results, work out where the positive cases are, support them to get better, and work out where else it might be.
How much consideration is being given to vaccinating young people, considering there have been a lot of the spreaders in this outbreak?
Yeah, look, I mean, I think the short answer is we're obviously tied into a broader national strategy around vaccination eligibility. We've accelerated that, I think, here in Victoria, rightly so, saying we've now got real quantities of Pfizer becoming available, the 70,000 a week. Let's start with the older age cohort, because we know that the older you are, the more vulnerable you are likely to be to coronavirus. We continue we have access to vaccination for anybody who's got comorbidities, for Aboriginal and Torres Strait Islanders people who are aged over 18. So there's a number of other groups that continue to be eligible for access to the right vaccine for them. We're not going to break ranks and then say, let's now start to pivot towards a different kind of cohort or a much younger cohort. We're going to go through it in the order that's been laid out by the Commonwealth. It's broadly the right approach. The constraint we have now we have demand here in Victoria, which is really good to see. We need to sustain this rhythm and this pace right through to the end of the year so we can get the adult population vaccinated.
Minister, there have been a number of arrests while we've been in this press conference in the city from an anti-lockdown protest that was allegedly cancelled but is obviously still going ahead. What's your response to that?
So look, the virus does not respond to protests. The virus responds to public health measures. There are 5 legal reasons to leave your home. Protesting against a virus isn't going to work. And if you do, you are breaching the public health orders, and Victoria Police will hold you to account for that, and that involves significant fines.
Can I just ask, Minister, as well, the Federal Health Minister, Greg Hunt, spoke again positively about the alternative quarantine proposal from Victoria. When are you expecting that an announcement on that might come?
Oh, look, I'm glad to hear that. There have been very positive work done between the Commonwealth and the state. I think we've now been granted access to the site, and we look forward to those conversations concluding as soon as practical, and for us getting on to deliver the 2 measures that we really need to as a ticket to get out of this pandemic. As Jerome indicated, we're just about reaching the ceiling of what our current supply of vaccines can provide us here in Victoria. The more vaccines we get, the quicker we'll get out of this. And the other risk is as we expose through the borders and return travellers through the quarantine system. And what we need is a risk-based, fit-for-purpose quarantine system that has the high-risk categories of people in the kind of facilities that we're talking to the Commonwealth about. If we can continue to work on those 2 things, once we get out of this outbreak, then I am confident that there's a pathway to land an end to this pandemic. But at the moment, whilst we're focusing on lots of issues all at once, our strongest focus is this short, sharp 7-day lockdown and working with all the Victorian community to close down these chains of transmissions as quickly as possible and get us back to the kind of life that we all want to lead.
Minister, can you talk around where the package is for business, the support package that was?
So, as I understand it, extensive work has already been done across government, and there were conversations with the Commonwealth. I'm not formally advised as to the outcomes of those conversations with the Commonwealth, but I did see some media reports that say that they weren't productive, but that won't stop the Victorian government in putting together a response. Done. Thank you, everyone.